Hello, my name is Sasha Panapa, and I am the director of the Unites program at the Communication Services for the Deaf. Today, I'm going to be moderating this incredible webinar. In order to celebrate Deaf Awareness Month, Caring Works has decided to organize this panel to discuss the impending mental health and substance abuse crisis and its impact all over the deaf community. These are very, very challenging times in Georgia and all over the United States. So now more than ever, we need to be united on the front lines to support our communities. Joining us today are Makoto Ikami, Carol Pollard, Deborah Guthman, and Kelly Sterling. Everyone's going to introduce themselves and show you their assigned names. Makoto, go ahead and start.
Hello and good morning. My name is Makoto. This is my sign name. I'm an ASL therapist working directly with Caring Works. We're just going to call it CW for short. I'm a licensed clinical therapist. I'm very excited to have this experience today to learn from you and share our knowledge.
Carol.
Good morning. My name is Carol Pollard. I am Associate Professor of Social Work at Kennesaw State University and also the founder and CEO of Caring Works, which is the organization that operates Hope House, a residential treatment facility for men experiencing homelessness and seeking recovery from addiction.
Thank you. Deb? Go ahead.
Good morning. My name is Kelly Sterling. I'm the Director of Deaf Services here in Georgia Department of Behavioral Health and Developmental Disabilities.
Okay, great. Thank you.
Our office is focused on providing coordinated care across the state for individuals suffering with mental health. We also are support providers for deaf and hard of hearing. Obviously, that's a great part of our advocacy to focus on addiction and to assist across the board. I'm also a licensed clinical social worker, and I am absolutely thrilled because I actually grew up with deaf parents. So I very much appreciate this panel discussion to focus on advocating and assisting all across deaf communities to serve our nation better. And especially with Georgia. So thank you so much.
Wow, this is an incredible panel. So we have a few categories of questions. Some of them will be about the advocacy work you do. Some are going to be on the state level. So first of all, anyone who does want to join, make sure that your video is on and your mic is on as well. If you're not answering, go ahead and make sure your mic is off. And if we are ready to go, we'll start. So the first category are deaf culture and client needs. So what are some barriers for the deaf and hard of hearing individuals as they are trying to get behavioral health care? What is the most effective way to work with them? I know in the hearing world, they have their own sort of system and culture set up around it. So I would be interested to see in the deaf world how that's different. Makota.
Well, first, thank you so much. And just so you know, it's a little bit nerve-wracking, but I'm going to try my best to answer that question. It can be kind of like a ball thrown at you the first time at a baseball game. So as far as the barriers are concerned, I myself was born deaf in a hearing family. I went to a hearing school, and I experienced a great deal of barriers on a daily basis. So for me, it's very difficult to decide which barriers to actually pick and share with you all today. It's very hard to prioritize which one. It's very limiting. So I gave it a good bit of thought, and I went ahead and made the decision to discuss 3 specific large barriers that me, myself, and the deaf community face. Of course, communication can be a very big challenge, including myself, of course. I graduated from college, university level, signing, I was able to write, but still a great deal of communication challenges that I experienced. So as far as the deaf community that we serve that have addiction and mental health problems, it's very limiting. There's a disparity out there as far as communication skills are concerned. And there's also a great lack of services. Today, it's gotten a lot better compared to the past. However, it is my belief that we still have a great deal of growing to do, that we could improve, especially for the services we provide. Case management services and others. There's all types of services involved with behavioral health, psychology services, referrals, recommendations. And also to see that in the staff level, it is also a barrier and a challenge, and I'd like to see that improve in the future. So as far as my experience is concerned, at Caring Works in Hope House, there's one member that we do work with that has mental health problems as well as addiction abuse that has been sent over to a psychiatrist to receive the appropriate medication. That member is deaf, and myself and the case manager had experienced there was a bit of psychosis regarding schizophrenia that was being overlooked on the doctor's level because they weren't able to appropriately identify those displaying characteristics. So we're hearing or seeing the information and transmitting that over to the doctor, but it's completely getting lost in translation. So we're very limited to what we can and cannot recommend to the doctors. And there's a lot of misunderstandings and misdiagnoses, unfortunately. It requires a lot of teamwork, which we have definitely put forth in to really try to explain that situation, to explain this deaf member has schizophrenia. Please provide the appropriate medication for that person. As far as Resperdal or Abilify is concerned, please prescribe those medications so that that member is able to have a clear diagnosis and treatment plan. But no, that person's receiving medication for depression and that's it. And there's no improvement that we're seeing. Perhaps the doctor's right, but that's not my recommendation or what I'm seeing on my level. So that is a bit frustrating, of course. And there's a lot of services that are lost on the doctor level, psychiatrist level, therapy level, case manager level. There's much training that could be used as far as acquiring sign language as a second language for the future for those staff members to improve services overall. And hopefully soon that's something that can be accomplished. Thirdly, I would speak on discrimination. As you all are well aware, the Americans with Disability Act was passed in 1990. It's been almost 30 years now. We're coming up on the anniversary for the ADA. If you were to compare this current situation back to 1990, it's been 30 years, there has been some improvement, of course. However, there's still discrimination that's experienced on the daily. We really have to work on educating people. We're still having people who are denied case management services and assistance for deaf members, providing interpreters, doctor's appointments that require interpreters. It's being denied. And we have to constantly explain the Americans with Disability Act so they understand. So that kind of thing, it's very frustrating. It's definitely a barrier, I would say. As far as the second question is concerned, how do we allow deaf people to navigate through a hearing world? Really, there's many people try to help deaf people, but there's a very big lack of it. People are assuming that the assistance and the services are there and set, but to be quite honest, it's not reflected the same way in the deaf world compared to the hearing world. Deaf people cannot simply read your lips and get a clear experience in communication. No, there's just a lot of assumptions that happen, and people aren't giving the opportunity to ask a deaf person what their preferences might be, what kind of services do they need, and to humble themselves a bit and advocate. Just try to feel what they're feeling. Yet you can, of course, sympathize, but empathize would be a much better way, and you can really see what could transpire. As far as ASL and deaf culture is concerned, that can be improved on as well from people getting a better understanding and experience from it.
Wow, Makoto.
Deb, would you like to add anything?
Yes, sorry. Makoto, you did a great job summarizing some key points, and I will piggyback on a lot of what you said. Excellent information. Over 30 years ago, when I was involved starting the Minnesota Substance Use Disorder Program, I thought that by now we would be at a different point than we are. And unfortunately, we continue to see some similar barriers, and we have had some positives in other areas as well. So one of the points that Makoto started to talk about really had to do with some concerns around health literacy, which I think is a big barrier that we need to look at. And these gaps start from being able to read the prescription drug and understanding why this drug is important to take. And for so many of the clients who do have dual diagnosis issues, medication to stay stable is so important, but yet we don't have access to a lot of that health care. We don't always have adequately trained sign language interpreters when meetings are occurring in doctors' offices or in different treatment settings. And there's actually research that shows that if more prevention is provided regarding health literacy, there would be a reduction in emergency room visits and other kinds of hospitalizations. So research actually shows we have an increase because we aren't providing a lot of that prevention information. And kind of going along with the theme of prevention, really that should start at a very young age. Having worked at the California School for the Deaf in Fremont for over 17 years, I know that using that as an example, there's such pressure placed on teachers, academics, graduation, the basic skills of reading, math, and writing, that there isn't a focus or time placed on the importance of prevention information. And in Minnesota at the Substance Use Disorder Program, we collect demographics and have for 30 years. And one of the questions we asked was, how old were you when you first used drugs or alcohol? And the average age is actually 10. So if you think about the age of 10, you're in about 4th grade. I know for a fact that most schools don't do any kind of prevention until kids are in health classes, which is usually 8th or 9th grade. Primary prevention should happen prior to first age of use. So if the first age of use is around 10, we're really missing the boat by not providing any of that information until a much later age. So we really need to all come together to provide more prevention at an earlier age. A lot of deaf individuals aren't necessarily aware of some of the dangers related to some of the different drugs out there and the impact on their body that the use of alcohol can have. And then as we move forward, this kind of relates to when an individual arrives in a treatment program. They're really missing a lot of that very basic information that is so important to have. And because we have so few professionals fluent in American Sign Language, able to provide direct communication in the area of drug and alcohol or mental health, it's really a detriment to our deaf community. We don't have enough training programs out there to get more people skilled to be able to provide that service. So we need to do a better job at offering additional training programs. And once a person finishes treatment, that lack of support, once they're out of treatment, we need more 12-step meetings that are accessible and more services altogether. In terms of some of the positives that have happened, there are some online programs for interpreters to help them become better skilled and understanding the unique terminology in both mental health and addiction work, and I think that's a positive. We also have some programs that have gotten grants through the Center for Disease Control to develop prevention materials about different kinds of diseases and medical issues in American Sign Language. We need to continue to have more projects funded to provide sign language for our community. I'm involved with a project that validated assessment screeners and different tools in an online portal available in American Sign Language, whereas in the past, assessments were only available in English. So hopefully through the resources that we'll share as part of this panel and a handout, you'll be able to have access to that information. So hopefully that'll give you both some of the barriers and some of the positives that we have happening in the community.
Wonderful. Deb, that was incredible. That was a wealth of information. Wow. And you're right. We absolutely have to start earlier with our interventions. If the beginning age is 10, that's a huge barrier, especially in school, because now we're talking about language access as well as education. That's an incredible amount of information. Do you mind expanding a little bit more about the ethical concerns that workers should be aware when working with the deaf and hard of hearing community?
Sure, definitely. I think one of the big issues for me has to do with dual relationships. Because in a treatment program, especially if we're talking about specialized treatment, meaning that the staff are deaf or hearing and fluent in sign language and able to communicate directly with the clients coming into treatment, we only have a few of those around the country. Chances are when a person enters treatment, that they may know other people in treatment with them. They may have used with those people in the past. They may know the counselor, the deaf counselor or hearing counselor. And in some cases, if that person is in recovery working as a counselor, they may have used with them as well. So there's a big responsibility to be very clear about the roles, confidentiality, and the importance of self-focus and not being worried about all of the peers around you and their experiences that you may have interacted with. In the deaf community, typically, because of the grapevine, which we're all familiar with, the community can be small. And typically in therapy, we tend to do more one-on-one. And when dealing with drug and alcohol treatment, we tend to do more group work. So there's a lot of education that needs to happen as well to the client to understand what a group means and that things you say in group stays in group. And so a lot more education really happens, and I think that's a huge ethic. It also puts a lot of responsibility onto the deaf or hearing clinician, because this dual relationship, maybe you're out in the community, maybe you're socializing in the community, and all of the eyes of the deaf community is on you, looking to see what you're doing. I know several deaf counselors who actually have told me that they're from smaller communities and they tend not to go out and socialize much because they feel that so many of the people in the community know their role and have these high expectations of them. And admit that at times it can actually be very lonely for them. Each person really needs to make sure they're getting support and clinical supervision so that they can feel, that they are able to carry on this important work. The other thing I wanted to just briefly mention, well, two other things. One, again, the importance of using certified sign language interpreters at all times. It's so easy when people go in for an assessment, if they can't find an interpreter, to bring a family member or someone else. And can you imagine being in that situation where you're there because you need help for drugs and alcohol and being open with someone who might be a family member? We need to remember to use certified interpreters and have background in the terminology that's used in those areas. The last thing I'll just briefly mention because of time is social media and boundaries. With the world around us today, with Facebook and postings on social media, and all of us may have a Facebook page, we need to remember that clients have access to that information and be very cautious about what is shared, and have in your mind or in your organization sort of a policy of how you're going to deal with that if it happens. Some people talk about having a professional page and a personal page, but be familiar with privacy tools and just the best practice when using social media. There's so many positives and negatives to it. So thank you.
Wow, these are incredible points. Thank you. Line between personal and private, and making sure that we are pulling in certified sign language interpreters. And the dual role, boundaries with our clients and our personal lives. That's such great information. Thank you so much. Makoto, is there anything you want to add?
Yes, briefly, if I could. Deb, absolutely fantastic topics to really point on. I absolutely would have to agree with you. One little piece that I wanted to add with that regarding ethics. In the deaf community, really, many deaf professionals, they do have dual or even 3 or 4 levels that they're working with as far as the role is concerned in their relationships. When I worked in Philadelphia, I learned about ethics. It was absolutely fascinating, and I was very strict in being in line with those ethics. Like if I wanted to go out with friends or go to happy hour, they have plenty of places where I could go to, but I felt really out of place doing that. Like, okay, I've got to remember what I'm doing here. I can't, as far as DC is concerned, where I lived at previously, to New York, there's a lot of clients that could see me in Philadelphia And now I'm in Atlanta. I mean, it's fairly far, but we have a small community we're working with. So it's really best not to be going out and doing a lot of crazy stuff, but absolutely, as far as the dual relationships are concerned, that's kind of a lifelong struggle that you'll have to deal with. And I really appreciate you sharing that, Deb.
All right, are we ready for the next category? The next category is going to be how we are all managing going through COVID. I mean, as we know, this has had an enormous impact on access to and all of our healthcare, honestly. So how has, obviously the pandemic has impacted everyone, but specifically, how has it impacted deaf people's lives with communication, with positives, and both positives and negative changes? So the COVID impact is massive, I know, but if you could sum it up for me, Makoto, that'd be great.
I'm sure everyone is overwhelmed. This is absolutely unfathomable what's going on. A lot of people are very depressed and feel lost, myself included. Depression, of course, creeps up, anxiety as well, and you can feel very stuck. However, the point is, you have to try to reframe and have a positive impact. First, let me explain a bit of a story as far as a negative impact, and then I'll discuss a positive impact. First of all, the requirement for masks. Okay, I get it. However, deaf people can't see your lips. They can't see your facial expressions. Perhaps people think, oh, okay, sign language just means that we're just using our hands. That's it, moving our hands. Absolutely not. It very much involves facial grammar and facial expression. So when that's overlooked, deaf people are, of course, going to very much catch on to not being able to access that information. We can get it, but it's different, So the requirement for masks, I completely understand the safety measure, and we really need to prioritize those safety precautions. However, the requirement of masks, while it may be appropriate, the ongoing activity of using them, of course, we have to try our best. For example, my face is very expressive, but I can only be expressive now from the nose bridge and up to my forehead. That's it. So we're very limited. And I'm perfectly fine with getting on board and doing all this. However, it's very difficult at times to really get the information clear, and you might be able to get the wrong impression. The situation might call for you to really see someone's mouth and face, so it could be frustrating. So the impact of the mask, I would say, has been a modality that's been a bit of a negative. However, when we're working with teleconferencing, we've transitioned over to that, especially with the mental health industry and therapists as well, providing services through telehealth. So I would say that that would be a plus, and that helps with addiction, mental health, and other issues. However, the deaf community is limited. So some deaf members, for example, don't know how to use a laptop. They've had so many years of homelessness and being all over the place that they might not even understand how to use a telephone, much less a laptop. So when they have arrived to Hope House, which thank goodness we do provide laptops to our members, it's kind of like, think about it when you first got your very first laptop. You had to be taught how to use it. First time you use Zoom, especially me, I can say, I was really awkward. I had to learn so many different avenues on how to use all the different features that it offers, and the support that I received from the team that helped me. So if somebody calls me at home, this isn't something that I'm typically used to. I'm used to going into the nurse's office, the doctor's appointment, and facing the doctor and having my appointment carried out in that manner. It can be done via Zoom. However, it's a bit difficult. That could be done as well with social work as well. So we value our help in the same way as the hearing community. And we're trying to teach our deaf members how to utilize laptops, how to use Zoom, how to put the ID number and the password into Zoom, making sure, to hit all the right icons, don't hit the wrong things, this is how you access it, that type of thing. There's all different parts to the puzzle. You can't just teach them one time either. It has to be repetitious. So that can be a challenge. But I do want to talk about the positives as well. So just to clarify, the masks, yes, they're completely understandable to reduce the spread of the pandemic. For deaf people and for hearing people, it's utilized at Hope House. Doctors, nurses, they also use them as well. So I would say that's one positive, because prior to a pandemic happening, I can't say that masks were used very often in the United States because it wasn't a great need. Now the pandemic has occurred, of course, we're seeing a lot of people get thrown off. We're able to have a different perspective on how to operate in the world. So before, sure, it might not have been nothing, but now it definitely is. I'm hoping that businesses can start to incorporate, including ours, for our deaf and hearing people, clear masks as well. So I would say that's a positive impact. We also received additions to our equipment in the office for our deaf and hearing staff. We're trying to figure out ways that we could provide access and improve that accessibility. However, also keep in mind the pandemic that's occurring and have more of a discussion in office. Prior to the pandemic happening, we were fine operating in the office, not a big deal. However, COVID happened and we just don't know what to do. The culture is completely different. So much has been thrown out the window. We really have to focus on communication, but we're focusing on other things such as Zoom to provide that communication access.
So Deb, is there anything you'd like to add?
Sure, I'd love to. Again, I think Makoto hit on a lot of the main issues that have really happened within just COVID in general, and the isolation and anxiety, not only for deaf members, hearing members, and also our deaf-blind population, which I've done some work with, and that's been extremely isolating for the deaf-blind population just because of technology. The other thing to keep in mind is just technology failures or crises that happen with that. You know, a lot of people maybe didn't have the right speed for their internet service, or maybe financially had issues with that, or maybe there were storms. I know in California, we would have power outages and then you'd be lost. And so again, for different people, that isolation. But in March, we actually saw an increase, 55% increase of alcohol sales as compared to last year. So that's a huge concern. And as you know, I would hear a lot about these virtual happy hours. And so there was this push for people who were feeling depressed and isolated, and our deaf community as well, to do what to drink. So we saw more issues with that. And when I was contacted by different people who were looking for treatment programs, especially early on in this process, treatment programs weren't able to take people in. Think back in March, we were all, you know, at home, sheltered in place. So deaf people and hearing people, anyone really, but focused on deaf people in need of treatment, we couldn't get them anywhere. There was nothing happening. And so that was just prolonging the health issues, the addiction, not to get the treatment. And then once programs started to open up, some required 2 weeks quarantine, COVID tests. And think back in the spring, it was hard to get those tests completed. So this caused all kinds of issues for people. Initially, when we started to use Zoom for 12-step meetings, increased 12-step meetings, we wanted to make it public. So through the Deaf Off Drugs and Alcohol on-site program, we've been using Zoom for 12-step meetings for quite a while. However, we wanted to make it more public for people to access. Well, we had never encountered what's called Zoom bombing, which was a huge negative experience. And that's where people come onto the site and do inappropriate things, sexually, language, cartoons. And early on, people didn't know how to get rid of them, how to have them leave the premises. So instead, they would shut down the meetings. And so then deaf people were losing out on having these meetings happen. Over time, people have become more used to using Zoom, how to get rid of these things from happening. And now that things have opened up a bit more, It's less of a problem, but still does happen. So just a few positives to throw into this. I actually have seen more meetings than ever be available for the deaf community. If you lived in a rural area before, maybe you had one meeting a week or month. Now you have 3, 4 or more meetings every day through Zoom. Some are all deaf meetings, some are interpreted meetings, and that's been just fantastic. Gallaudet University has developed some different ASL accessible videos, how to survive COVID during the April month when it was alcohol awareness. They put together some great videos. They also, their peer health advocates, put together some prevention materials, all in ASL. And for me, the most exciting thing is to see a video called The Social Distance Challenge, which was members of the deaf recovering community who for the first time came together and developed this inspiring video talking about sobriety and their lengths of sobriety. And we'll have a handout sheet available for you, and it has that link. And I would encourage all of you who want to be inspired by something positive that's come out of this to take a look at that.
Perfect. So Kelly, I am curious. I didn't know if you wanted to add anything about telehealth, especially focusing on the mental health and how it can be effective for the deaf and hard of hearing community.
Sure. Good morning, everyone. Thank you for the opportunity. And really just kind of piggybacking upon, what Dr. Guthman has said and what Mikado have said, as a state, we have relaxed the requirements and guidelines for the utilization of telehealth. This was in relation to how the federal government also relaxed their restrictions. And so it really created a greater opportunity for providers to make sure that individuals were accessing supports and services in a virtual environment. Obviously, within the deaf community, we've been comfortable with this technology. And so it's been that process of educating providers on how they can provide that same level of quality services that they previously had been providing in person, and now to conduct those in a remote environment. We have seen, a great deal of success in that. We've also continued to support providers giving telehealth as an option, but also continued to provide in-person support when it's safe as well across the state. We want to make sure that access to services, even if the clinician might be remote, that the individual who's deaf still has the same level of access that they had prior to the use of telehealth. We've really tried to be very creative, but really trying to meet the individual's needs for communication access.
Wow, this is amazing how this pandemic has evolved all of our lives. And that some of the positive consequences are that we have more services available ever. And it's got a lot of opportunities for the deaf community, especially related to mental health. That's great. Thank you for those answers. Our next category really does look at the frontline people who are providing services, boots on the ground. And how has the pandemic impacted the organizations who provide services for the deaf and hard of hearing community? How is that working? How is it not working? Deb, do you have anything to say?
You want me to go ahead, or Carol, did you want to start and then I'll add?
Yeah, I'm happy to begin.
Okay.
Yeah.
Carol, yeah.
Yes. Hi. So obviously my primary focus in this discussion would be how we are operating and handling services at Hope House. And to give you some context, we have been providing residential treatment services and activities for deaf and hard of hearing men since 2012. And so the contrast for the before and the now is pretty significant. Over that time, we are continuing to evolve in our understanding and efficacy in providing a welcoming, nurturing environment for our clients, particularly our deaf clients. And the advent of the pandemic obviously posed challenges both to our hearing clients as well as our deaf and hard of hearing, and our staff. So we have hearing staff as well as deaf staff on board. And from my perspective, in running this organization, the primary concern that I would have in any instance is how do we optimize the well-being of our clients and the safety of our staff. The introduction of a pandemic in this circumstance, of course, heightened our awareness and alert almost immediately of the challenges that that would pose to providing effective services. And so one of the things that we did, which Deb alluded to earlier, is that we maintained a strict hold on the census count. The number of people we did not, and we currently still are not operating at full capacity, because in the event someone tested positive for COVID, we needed to be able to have resources and space for that individual to be safely isolated, or if it's a staff member, for them to be safely isolated. And so for us, of course, we've always had concerns about safety and providing a healthy environment, but the advent of a pandemic made sure that we were adhering and creating new policies as it related to infection control, the careful sanitizing of the building, making sure that we were following CDC guidelines with social distancing, which is kind of hard to do in a residential facility. One of the things we were able to secure were the clear face shields for deaf staff to work with. But of course, as Makoto mentioned, we still have a need for staff to wear masks. So it had limited effectiveness, but it at least was something or an additional thing that we could attempt. So I think for us, and especially operating in the state of Georgia, where the budget concerns are immediately apparent from operating as an organization, we also are aware that the budget's going to get tighter. The tax base is reduced, employment has declined, tax revenue has declined, and that has a cascading effect on providers, whether they're serving hearing clients or deaf clients, in being able to have adequate resources to serve our men. And so the effects of that are not necessarily immediate, but it is something that we have to prepare for going forward.
Wow, hats off for CaringWorks doing all of that during this time and just really trying to be creative with your responses and making sure that the organization continued to go. Really well done. Makoto, is there anything you'd like to add?
Yes, I feel the CaringWorks has definitely provided a wonderful support to the members and staff at Hope House to provide a safe environment, especially the clear shields. That's been very helpful, and the mask, of course. It just provided a bit more protection. I'm thrilled and happy, to have other additional ways. Like, for example, at our desk in the office, they would, how you go to the store and sometimes they'll have a clear, like acrylic shield on the tables or desks. So I kind of nudged my boss and was like, hey, is there any way we might be able to incorporate that at Hope House and CaringWorks? Just in the office, if a member or client, we're having a one-on-one in my office, of course, policy dictates we have to wear a mask to protect ourselves and to protect the client, yes. However, like before, number one thing is communication challenges I mentioned before. So for myself, communication, of course, is very important, as well as safety, but you kind of have to pick which one's going to be most important. And it's very difficult. Wearing a mask all the time, there could be so many misunderstandings. It could be very frustrating for all parties involved. So in this fashion, I can take my mask off a bit, provide the services directly in ASL. So it's a nice creative way. There's a little bit of a risk there involved. However, it's a very creative measure that can be incorporated. And I've seen much better of a therapeutic experience for my clients. Of course, they still have the mask on. However, they can move it down if they just need to get some clarification really quick. And you don't have to worry about the virus jumping over the plastic screen there. So I want to thank you, Carol, for providing that on our desks in our office. It has been such a great help. And my goodness, a big burden that's been kind of lifted off of me so I can focus on my clients and that communication that needs to happen. And yes, we don't have to worry so much about safety because that's been taken care of by leadership. So thank you for that.
That is actually really great tip. So how we can really be thinking about how to reframe being back in person, like having a piece of plastic there. That's a great tip. We are a little behind on time. Sorry. Kelly, would you like to add a little bit to that question? Because I know we were talking about the organizational impact of COVID.
Yes, thank you. You know, I think it's important to highlight, you know, the statewide efforts and what the department has done to support providers and as they serve individuals in our communities. The Office of Behavioral Health Prevention and federal grants has increased their media campaigns, really focusing on both substance abuse and substance use treatment options and mental health services around the state. The department has supported the kind of implementation of a COVID-19 emotional support line. It's open daily from 8 a.m. to 11 p.m. They're soon expanding to add a text chat feature. The department is supporting provider awareness related to mental health strategies, not just for the people they serve, but obviously for providers, the therapists, the staff who work at these agencies who are also experiencing difficulties during COVID-19. They have strategies, tips, how to manage what they're going through at this point in time. We, as a state, we're also fortunate to receive a COVID-19 emergency treatment response grant. It's $2 million slated towards different projects across the state, spanning all of our offices. The populations of focus are including medication-assisted treatment, deaf individuals across the state, healthcare workers, victims of human trafficking, and individuals accessing our warm line services, such as our Georgia Crisis and Access Line, as well as the COVID-19 emotional support line. We also, in this past year, were able to get a COVID-19 suicide prevention grant. It's $800,000 slated towards providers to focus on older adults, survivors of domestic violence, unemployed persons, and we're working in partnership with the Division of Aging Services and the Georgia Department of Labor to really roll that out across the state.
Carol, is there anything you'd like to add?
Yeah, just briefly, because I know that we're short on time, but I would feel remiss in not thanking you, Sasha, and your organization, because the support that we received from you in getting critical laptops really helped us navigate this COVID experience in enabling our clients to access the resources that are available online, and it made all the difference in the world in us being able to manage this pandemic as well as we have.
Thank you. Makoto, do you have anything?
Carol, yes, the members, once they saw that, absolutely, I was there at the time that the members were able to see their new laptops from CSD. My gosh, they were absolutely enthralled. Their eyes just lit up like stars. It was such a big difference comparatively to what they've been going through. Sure, they had phones, but you know, a nice little fancy iPhone, but it's not a laptop for them to use. So that was extremely helpful and very inspiring for them. They had so many questions, so much enthusiasm. So anyway, it was just absolutely fantastic. I just very much appreciated the opportunity to work with them in that endeavor. They were not being able, of course, to learn quickly and just move forward. It might have taken a little bit of some time. We worked with 4 different members. It's a new laptop, of course, from CSD, so we had to provide some training on how to use it and how the functions work and everything. So it kept us very, very busy, to say the least. However, I very much appreciate and that gift to our organization that Carol just mentioned as well. I just wanted to really let you know that I look forward to the relationship and partnership with CSD for the future, for sure.
Yes, we did notice how COVID has severely impacted the deaf and hard of hearing community. And it's not just addiction, but everybody's needing telemental health services right now. So being able to get out laptops to the deaf and hard of hearing community so that they can access that, as well as learn all the skills that come with using a laptop. I think we have one last question, or at least time enough for one last one. And so I can ask all of you really, because I'm curious. So with this pandemic, what do you see the results happening going forward? How do you see the impact and the results from this pandemic going forward in our profession?
Yeah, Sasha, thank you for the opportunity to answer that. You know, I anticipate obviously that telehealth will remain a vital component of what providers kind of go to when they're thinking about how they can serve individuals. And I believe that this is going to present, you know, a positive and a negative. I believe it highlights the digital divide that we have and what, you know, Communication Services for the Deaf has contributed to Hope House is such an incredible asset, you know, and I think state governments, local community governments will have to better support infrastructure development to support individual access in their home environments across the state to their resources that are available to make sure that the quality of services, that there's clear communication occurring, that the previous satisfaction relative to services is maintained once those services fully go online, and that individuals can still feel that sense of connection to their service providers. You know, I think in every challenge, there's an opportunity to enhance our programming. You know, as providers and a state agency, we're always reviewing and evaluating our service delivery, the current models and how we're focusing and approaching in the review of those models. You know, I believe that focus on patient health and well-being is going to increase, you know, just the effectiveness of programs because the system will be more adaptive to the individual needs, more flexible to better address communication needs, and it'll be focused on what the individual needs in the context of their community and in their environment.
Absolutely. Deb, anything to add?
I wanted to add a couple things related to clinical aspect and then just training for professionals and the changes that I think will happen in those areas. I know with some of the universities, especially as an example, Gallaudet, that is still remote this fall, one of the barriers and issues that had to be dealt with was the students are back home, but they still need mental health support. And because they're located in Washington, D.C., the counselors are licensed through Washington, D.C. Some states granted waivers for those kinds of things, and in D.C., they did not. So quickly, all of the counselors became life coaches so that they could be providing support in that way, which I thought was very creative, so that the students were still getting a benefit of the support that they needed. From an organizational standpoint, some of the larger deaf-related organizations, such as ADERA and others that are usually dependent on having in-person conferences, are looking towards doing things more virtually. And the positive of that is that more people that have travel restrictions will be able to participate. A negative, obviously, is the in-person contact that we all crave and want and benefit from. But we've seen that the mental health interpreter training program in Alabama went virtual this year. the Southeast Regional Institute for the Deaf conference in October, postponed, but is going to be doing a few virtual workshops. And as I mentioned before, we have more 12-step meetings and more options for sponsors and people meeting people they never would have met before in recovery. So it's navigating a whole new world that will continue to be a challenge. But I think if we keep our eye on some of those positives, we'll get through it together. Thank you again for having me be part of this. It's so important to share this information.
So Makoto and Carol, have you seen anything for Caring Works coming up? Do you think that will change for the rest of time because of COVID, that this pandemic will have impacted in that way? Makoto, that's fine.
I guess I'll answer first, sure. So looking back, prior, around February, March, right before COVID hit, we had the everyday norm, you know, living our life as we would and have been for quite some time. We had our deaf team. And then all of a sudden, this pandemic just really rocked the boat. The deaf team that we had in place, the access to information, because of COVID, was kind of difficult to figure out together, and it became a bit more limited. It wasn't an immediate response that we were able to rectify, but we caught all the problems as they started to come up. We were lucky enough and fortunate enough to have social workers and case managers that are hard of hearing or deaf, and that provides services to our deaf clients. We were able to set up Zoom for an ongoing basis, just to make sure, okay, we're all on a good page. That support is there. So we have, you know, to a certain degree, that human connection. It doesn't particularly apply to hearing or deaf culture. However, we were able to respond to an emergency and find ways that we could support each other and be there for each other and work together as a team. So that's what I've seen so far. Now, as far as the crisis that's happening and looking forward, how that might look, it's very important to focus on today and look for people, look for things, ask for questions that might be able to assist each other. I think that's really an important aspect. And I'm lucky to have that type of thing in place at the place of my work with Caring Works.
Carol, would you like to add anything before we wrap up?
Yes, and I'll be brief. I think for all of us, this experience has taught us to take nothing for granted. Every day is extremely precious, and the people in our lives become even more precious to us. And I think this experience in the context of work, and specifically Hope House and our programming, is that we have collectively and are collectively going through a crisis together. And I think there's a shared experience and a bonding that takes place as a result of that. And so the takeaways that I would hope occurs is that we have a heightened level of trust among our colleagues and with our team, that we are now recognizing our capacity to innovate. We've been forced to be creative, and that has been nurtured. And so I hope that Makoto and Kevin and the other members of our team take from this the recognition that we are completely open to new ideas and better ways of doing this work. And so if anything, that's the lemonade out of the lemons of COVID-19 that I am most grateful for.
That's wonderful. Thank you all so much for your wisdom, your expertise, and your experiences that you've been sharing with us. This has been incredibly beneficial. I sort of want to wrap up on something that Kelly was talking about, is looking at challenges as opportunities, because sometimes we can look at a challenge and get really frustrated, but if we change and reframe it to an opportunity, it's going to be a lot easier for us to move forward and get creative. And if we can hold on to that and looking at how we can use telemental health and all of these awesome tools that we're just getting in order to be able to support our community. If anyone has any questions, we've got resources and a list of articles in Georgia and beyond. So for people who, for those of you who are frontline advocate and therapists and experts, and to the deaf community at large, stay safe and united. Thank you.